Thank you very much. Next is we are going to hear from the minister in the presidency, Minister Mondli Gugubele, who is the minister in the presidency. When I want to be different, I say he is the chairperson of the National Planning Commission. And he is also responsible for all the work that we do in the center of government. He is also leading the work that is done by Statistics South Africa. He leads the work that is done by GCIS. He leads the work that is done by SSA. So he is the minister in the presidency and the minister that leads the work that all of us do. So as he's going to speak to us about this project, I am sure he's also going to assist us in terms of how this country should be able to look forward beyond COVID-19. Minister, we are in your hands.
Program Director, Dr. Masiten, who is the Acting Secretary of National Planning Commission Secretariat, representatives of partner institutions, Ms. Ronette Angela, and her warm words of welcome, Acting Head of Government, who is the Acting Head of Government Technical Advisory Center, commonly known as Gtac, and Dr. Beverly Demons. I call it Demon. Who is the Group Executive of National Research Foundation. Mr. Robert, Director General in absentia, is here. Okay. I know by heart he is here. Of DPME. Honorable guests, ladies and gentlemen, I thought before I read my speech to say to Ms. Damons, when thanking us for having confidence in you, I was saying to Mr. Mashamba, who leads the project, you speak as if we've got a choice. So failing to have trust in you, failing to have confidence in you, is to believe that we can take away trust from our eyes and hope to walk again. So we don't have a choice. Honorable guests, I thank you for joining us this morning for the official launch of the first edition of South Africa's COVID-19 country report. Some of you may be asking why such a report has been produced in the first place and what its relevance is to South Africa. There are two key reasons that I want to share with you. Firstly, at the onset of COVID-19, most of us knew very little about it. Scientific explanations were being offered about the epidemiology of this disease. Its outbreak was fast and received a great attention from the World Health Organization. All signs were indicating that we were about to face something major. For posterity, it was crucial that have a proper record of what actually transpired and how did we deal with it as a country. In other words, it's important to have this record, not only for the sake of record, but to ensure that we open South Africans, open their eyes to the capabilities they undermine, the national capabilities which help them to survive such a monster. The first edition of the country report, therefore, makes an important contribution by providing a descriptive analysis of what transpires based on the information available at a time. Of what transpired, my apology. The first edition of the country report, therefore, makes an important contribution by providing a descriptive analysis based on the information available at the time. Secondly, it is important that we pick up lessons from our collective experiences to improve things going forward. It is through learning that we can sharpen our focus in enhancing the capability of the state to deal with outbreaks and other forms of disaster going forward. This is in line with priority one of the current government administration, which is about building a capable, ethical, and a developmental state. With this said, I acknowledge the foresight of the late Minister Jackson Mthembu, may his soul rest in peace, and the DPME team for recognizing at the onset of the pandemic that the research towards the development of a country report needed to be initiated. The report as it is will be an important reference for future generations. The COVID-19 country report series, therefore, records the storyline and broad understanding of how South Africa has managed, responded to, and curtailed the negative effects of the pandemic. The immediate value of the research on the country report was derived during the research process, wherein a space was provided for interactions among the researchers and practitioners from various disciplines and capacities to build the South African narrative on the COVID-19. As the research and analysis proceeded, various actors improved their understanding of the pandemic, and in the same way, lessons were being drawn, fitting into the relevant decision-making processes and helping to improve the response measures. The first edition of the report that we are launching today has reference period of up to March 2021, basically covering the first and second waves of the pandemic. As you would know, after this date, further waves of COVID-19 infections occurred, which were characterized by the periods of increased transmissions in the country, which were around July 2021, December 2021, and to a lesser extent, May 2022. Research has continued towards the production of the second to cover an extended understanding the effect of the pandemic and some of the outcomes of the interventions implemented. Presented health crisis with major implications for the economy and society. There were sad moments as the number of deaths escalated, taking a toll on the families, friends, neighbors, and the frontline workers. Pre-existing socio-economic challenges of unemployment, poverty, and inequality were amplified. Among other things, valuable learning time at school was interrupted. The complex nature of the pandemic required a multi-pronged, multi-sector approach. Accordingly, South Africa's response was comprehensive and visibly led by the President and the Minister of Health. Overall, the response emphasized saving lives and saving livelihoods. The approach followed by South Africa, was appropriate for local conditions and resonates with the conclusion of the independent panel for pandemic preparedness and response that was commissioned by Director General of World Health Organization, which noted that countries that successfully managed the COVID-19 pandemic adopted inclusive whole of society and whole government approaches by seeking scientific guidance, engaging health professionals across the board, including community leaders and involving vulnerable and marginalized populations through a coordinated approach between national and subnational governments. Ladies and gentlemen, as we stand now, there are numerous lessons on what we have worked well and what have not worked well, and specific recommendations on what to do. With a year elapsed since the report's content was finalized, the context has changed and various decisions and actions relating to some of other recommendations have been made or acted upon. Data shows that COVID-19 infection rates, hospitalizations, and intensive care admissions due to COVID-19 have reduced substantially compared to the same period last year. To date, important steps taken include the announcement of Economic Reconstruction and Recovery Plan in October 2020, which signaled a shift in the focus of government towards stabilization and recovery. There has been successive lowering of the alert levels, culminating in the termination of national state of disaster in April 2022 and eventual repeal of regulations on the wearing of masks, limitations on gatherings, and travel requirements in June 2022. I still have to get used to life without a mask. The vaccination program in South Africa kicked off in January 2021 as a key defense against severe illness and loss of lives. To date in South Africa, about 36.8 million COVID-19 vaccines have been administered, with about 19 million people fully vaccinated. The extension of the social assistance program has been effected through the Social Relief of Distress Grant until 2023. These are just some of the examples. The question is, ladies and gentlemen, how effective was the overall country response? What are we learning from this experience? The good and the bad? What needs to be sustained as a lasting legacy? The evidence-based approach of seeking scientific guidance in considering the multiple trade-offs right from the start enabled South Africa to implement decisive and appropriate steps in managing the pandemic. The scientific research institutions and relevant advisory structures demonstrated their readiness and agility in this regard. The Disaster Management Act has provided a strong legal framework for managing the COVID-19 threat. The National Disaster Management Center and the National Joint Operation and Intelligence Structures were ready to provide the required response in line with their appointed mandates. Contribution of all social partners, the business, labor, civil society, philanthropic organization, the media, and ordinary citizens was visible. The Solidarity Fund stood out as a successful partnership between government, social partners, and academia, working together to ensure national resilience and hope. In hindsight, as articulated in the report, we're launching today. The constellation of all these structures and processes functioned well and complemented the existing national capability that was required for the task at hand. Implicit in South Africa's national response was the sincere consideration of the historical context of inequality and how it has manifested in the structure of society as it is today. Right at the outset, we could foresee that people living in low income groups, those in informal settlements, larger families, those dependent on the informal sector, women, children, and homeless were likely to be more vulnerable to the ravages of pandemic. Policymakers and regulators crafted the country's response to the pandemic fully cognizant of these realities. Appropriate social safety nets were put in place to mitigate the negative impacts of the pandemic, especially on the most vulnerable. In the midst of all the disruptions, new emerged, new opportunities emerged, I beg your pardon. The quick transition into electronic and virtual platforms facilitated regular and efficient meetings between the delivery partners. These are the opportunities that emerge and an opening to greater capabilities at our disposal. This enabled government to find new ways of coordinating actions at various levels. Online meetings have now become a norm. Innovations in the data science, research, disease surveillance, epidemiologies, epidemiology have strengthened the capacity of the state with regard to evidence generation, dissemination, and use. South Africa was effective in using its international relations to access technical, financial, and human resource support from the international community and serving as a strong voice advocating not only its interest, but the interest of the African continent and the developing countries. The government communications approach has been inclusive, reaching different population groups in different languages, different media, digital and community-based platforms, and now serves as blueprint for government communication going forward. The country scaled up its industrial capability to manufacture essential items such as ventilators, vitamin supplements, oxygen intensive care units, testing kits, and establishment of facilities to produce COVID 19 vaccines. Equally, there were challenges encountered. Amongst those, the unevenness in the state of readiness and capacity of the various management centers in various parts of the country became apparent. The pandemic exposed existing coverage and reliability gaps with respect to basic amenities and spatial inequality. This highlighted vulnerabilities of specific communities to several risks associated with gaps in the provision of water, sanitation, healthcare, food, transport, ICT services, especially for online learning platforms for the majority of learners. The corrupt practices and collusion between different actors undermined confidence and generated widespread public anger. Examples include overpricing of essential items, abuse of emergency procurement, looting of resources, diverting of social assistance such as food parcels. There were worrying trends regarding negative experiences of women, including incidents of gender-based violence. Many lessons, ladies and gentlemen, have been learned, and much can still be explored as we engage in economic recovery process. Greater attention is required in certain areas, and some of them require immediate policy responses. These include support for small businesses, government interface with informal businesses, the effectiveness of measures to counter GBV and femicide, etc. Relevant departments must integrate these into appropriate programs. Some of the issues require a response over medium to long term. I acknowledge contribution made by researchers recruited by the National Research Foundation in partnership with Government Technical Advisor Center, Gtac, and the DPME in producing this report, which demonstrates successful collaboration between government and academia in generating knowledge. South African government will forever be grateful to all who have been on the front line every single day fighting the COVID-19 pandemic. I thank you.